the older adult home visit program, we're exposed to as first-year students. We meet with a pharmacy student and a social worker student. Sometimes OT/PT is involved as well. We're assigned a senior citizen to go visit. We all meet at a senior citizen's location where they live. We go in and we just kind of have a discussion and we talk. What's interesting about it is that each of us comes in with a different perspective. A social worker student approaches a situation with more of a environmental aspect. Social work I thought was very interesting because they came in with a genogram and they sat down and went through family history back until as far the patient could remember. And we were actually able to elucidate a lot of information that otherwise probably wouldn't have been brought up, even in any kind of physician's, office.
We go through their medications, their herbals, their vitamins, and we talk to them and see if they know why they're on them, how they're taking them. We also talk about lifestyle interventions like exercise and diet, things that they can do in their lifestyle to change their health.
You also have your interprofessional opinions right in the same room where you can help make better decisions. Everybody's in communication with each other. It was a real-life experience.
In jest, I like to say it's designed to see if I know who I am, where I am, what meds I take, and whether or not I have friends. I'm delighted to participate. I think it's wonderful that they've, number one, integrated the various courses of study and recognized that health issues and quality of life issues for older people can't just be segmented, that it is an integrated experience. And so I am extremely enthusiastic about the fact that they're using this interdisciplinary approach. It's wonderful.
They come very well prepared with questions and sometimes even very pointed kinds of exercises. I remember the pharmacology student actually had bottles to see if I could open them, for example. It's very pleasant and it's really nice to see young students. They're usually very enthusiastic and eager to hear what I have to say and ask some very good follow-up questions too.
My own story about my problem, about my disease, might be helpful to them. In your study, you read the various examples, how this happens, but practically they were able to see a patient. So maybe that was a good experience for them.
The Wayne State students are fantastic. We're very concerned about security at this age and everything. And so as we talk about it, they give me some new ideas that I can take home to my wife, and I think I give them some ideas of what we're doing as seniors. It's just fun to be with these young people. Really, it makes me think about why we do what we do.
It's a learning situation on both sides. Yeah, they learn and we learn. I feel that the Wayne State students are passionate about their interest in the program and what they're doing. The classroom is theory. And when you get outside the classroom doors, you're dealing with real life. This is what you will face once you get out of the classroom is real life.
Now when I'm in the hospital as a fourth-year medical student, I see that it's not just a physician talking to a patient. It's a physician communicating with their surroundings, communicating with the pharmacist, communicating with the social worker to provide the most optimum care to the patient. Doing this home visit really brought about that feeling in me that I wanted to recreate with all of my patients in the future. I liked sitting and speaking and not being seen as a physician who's telling a patient what to do, but a physician who's communicating. And it's a friendship, essentially, that you're creating with your patients. That was the moment in time that I realized I wanted to do internal medicine.
It's really great that Wayne State University offers this opportunity to us to work as a whole team, as a unit, and better manage a patient's health care. It's important for us to learn and for us to take this opportunity to apply it to our future careers, but it's also important for us to show the community what we're doing and our roles in healthcare. The more we have the opportunity to have these real-life experiences, the more we are able to grow and help the community grow with us. It's a win-win on both sides.
Just by being here for 9 years at this point, I've been able to see so much change that it's incredible that if in the last 9 years we've come this far, who can even imagine how much farther we can take it in the near future? I've loved my time on this campus, and I'm so excited to see what happens. The education I've received here and the mentorships and the relationships I've created, I know will be with me lifelong. I want to give back to the university because it's given so much to me.